find yourself rushing to the bathroom constantly throughout the day, or perhaps you are suddenly hit with such a strong, uncontrollable urge to go that you simply can't make it in time, leading to embarrassing accidents. Maybe your sleep is ruined because you are waking up multiple times every single night just to relieve yourself. If any of this sounds familiar, you might be dealing with a condition known as overactive bladder. I'm Dr. Evelyn Hartwell, a urologist and pelvic surgeon, and today we're going to take a deep dive into everything you need to know about overactive bladder. If you are new to my channel, I create educational content every week covering sexual health, bladder health, and general urologic wellness. So if you find this information helpful, please make sure to subscribe and share this with friends who might benefit from it. To understand this condition, we first need to identify what overactive bladder actually looks like in daily life. There are 4 major symptoms that characterize this issue. The first is urinary frequency. This is defined as having to go to the bathroom much more often than what is considered average. In the world of urology, we generally consider urinating more than 8 times in a 24-hour period to be abnormal. Of course, there are caveats to this. If you are drinking gallons of water a day, naturally, you're going to use the restroom more often. However, if your frequency is disrupting your day and affecting your quality of life, that is a red flag we need to address. The second symptom is urgency. This isn't just a casual need to pee. It is a sudden, compelling desire to urinate that is difficult to defer. It's that panic moment where your bladder tells you that you need to go right now, and you cannot hold it off. Sometimes this urgency is so intense that it leads to the third symptom, which is bladder leakage or having an accident before you can reach a toilet. We call this urgency urinary incontinence. Finally, the fourth symptom is nocturia, which is the medical term for waking up at night to urinate. Waking up more than 1 time per night is considered abnormal and can severely fragment your sleep. When you take these symptoms together, frequency, urgency, leakage, and nocturia, you have the clinical picture of overactive bladder. It is crucial to understand that overactive bladder is not just a medical checklist. It is a condition that deeply affects a person's quality of life. It isn't as simple as just going to the bathroom a lot. It can severely impact how productive you are at work because you are constantly stepping away from your desk. It can lead to social isolation because people become afraid to leave their homes. I have patients who have to mentally map out every bathroom in a shopping center or restaurant before they go, just out of fear of having an accident. Many people stop going to the movies, taking long car rides, or traveling altogether because the anxiety of needing a restroom is just too high. Financially, this condition can also be a massive burden. The cost of absorbent pads, adult diapers, specialized underwear, and extra bedding laundry can add up to a significant amount of money over time. Furthermore, studies have shown that about 16% of the population deals with these symptoms. That is a huge number of people suffering, often in silence. It can even affect your intimate relationships. The fear of having an accident during sex can completely inhibit your desire to be intimate with a partner. So, what actually causes overactive bladder? There isn't one single culprit, but rather a variety of contributing factors. Age is a very common cause. As we get older, the prevalence of these symptoms increases, though it is important to note that just because it is common with aging does not mean it is normal or that you have to live with it. Being overweight is another significant factor, particularly regarding leakage. Research on women who are obese shows they have a 3-fold increase in the likelihood of urinary incontinence episodes compared to women of a healthy weight. Your medical history plays a role as well. Women who have had multiple vaginal deliveries or difficult pregnancies may experience these issues later in life. Underlying medical conditions like diabetes, untreated depression, or a history of pelvic surgeries, such as a hysterectomy or radiation therapy, can damage the nerves or tissues involved in bladder control. Neurological conditions are also major contributors. Issues like multiple sclerosis, Parkinson's disease, spinal cord injuries, or a history of stroke can interrupt the signals between the brain and the bladder. Even past surgeries meant to fix leakage, like midurethral slings for stress incontinence, leakage when coughing or sneezing, can sometimes cause an obstruction that worsens urgency symptoms. We also have to look at acute issues like recurrent urinary tract infections or side effects from medications, specifically diuretics or water pills taken for high blood pressure, which are designed to make you urinate more. When you come to see a urologist like me for these symptoms, the process is very thorough. We start by asking detailed questions. When do the accidents happen? How many pads are you using? Is it the frequency or the waking up at night that bothers you most? We review your history for those contributing factors I mentioned, like diabetes or past surgeries. Then, we perform a physical examination. In women, we look for pelvic organ prolapse or abnormalities like cysts around the urethra. In men, we perform a prostate exam to see if an enlarged prostate is blocking the flow of urine, which often mimics overactive bladder symptoms. We will also test your urine to rule out blood or active infections, as those are easily treatable causes. Additionally, we typically perform a bladder scan or a post-void residual test. This is a painless, non-invasive ultrasound done right after you urinate to see how much urine is left behind. This is critical because we need to know if you are emptying your bladder well. Sometimes, leakage happens because the bladder is overflowing, not because it is overactive. I know this can feel overwhelming, which is why I have a special surprise for you. I have created a comprehensive overactive bladder guide that is completely free. It is designed to help you figure out exactly what symptoms you have, how to manage them, and even how to care for a loved one with this condition. You can find the link in the description below to download it. Now, let's talk about the good news, treatments. We have many ways to manage this. We usually start with lifestyle changes. As I mentioned, weight plays a huge role. Studies indicate that losing as little as 8% of your body weight, so if you are 200 pounds, that is roughly 16 pounds, can significantly improve urinary symptoms. That is a very achievable goal to start with. Diet is another major factor. We advise avoiding bladder irritants. I have a whole video dedicated to this. But the main culprits are usually alcohol, caffeine, spicy foods, highly acidic foods like citrus or tomato, artificial sweeteners, and carbonated beverages. I always tell my patients, do not make your life miserable by cutting everything out at once. Try eliminating one thing, like caffeine, for a few days. If you see no change, add it back and try eliminating spicy food. It's about finding your specific triggers without driving yourself crazy. Fluid management is also key. You need to find the Goldilocks zone. If you drink too much, you will obviously go more often. But if you drink too little, your urine becomes concentrated and dark, which actually irritates the bladder lining and makes urgency worse. I suggest drinking fluids with your meals and then sipping water throughout the day rather than chugging huge amounts at once. Also, avoiding constipation is vital. The rectum sits right behind the bladder. If the rectum is full of stool, it pushes against the bladder, reducing the room it has to expand and triggering urgency. And, of course, if you smoke, please quit. Smoking irritates the bladder and is a leading risk factor for bladder cancer. If lifestyle changes aren't enough, we can look at pelvic floor physical therapy. A therapist can teach you exercises to retrain your bladder. I explain urgency like a bell curve. The urge hits a peak, and most people run to the bathroom at that peak. But if you can distract yourself, perhaps by doing some quick Kegel exercises, the urge will eventually subside on the back end of the curve, allowing you to walk to the bathroom calmly. When behavioral changes and therapy aren't enough, we move to medications. There are pills available that help relax the bladder muscle or stop it from squeezing when it shouldn't. If pills don't work or cause too many side effects, we have advanced therapies. One option is bladder Botox, where we inject Botox directly into the bladder muscle. This helps relax the bladder and is effective for about 6 to 9 months before needing a repeat injection. Another option is a bladder pacemaker, also known as sacral neuromodulation, which regulates the nerve signals to the bladder. Both are about 80% effective. Finally, there is a less invasive option called percutaneous tibial nerve stimulation, PTNS. Think of this like acupuncture for the bladder. We place a tiny needle near the ankle to stimulate the tibial nerve, which shares a root with the bladder nerves. You come in for 30 minutes, once a week for 12 weeks. It requires a time commitment, but it can improve symptoms by 60 to 70%. There is even a new implantable device for the ankle that allows you to do this therapy at home. The bottom line is that you do not have to live with overactive bladder. We have a massive toolbox of treatments, ranging from simple diet changes to advanced therapies. If you are suffering, please see a urologist. We can help you get your life back. As always, take care of yourself because you are worth it.